Dietary inflammation. A critical factor in managing coronary heart disease, new research highlights a significant link between dietary patterns and long-term health outcomes for individuals already living with coronary artery disease, CAD. A recent study published in Frontiers in Nutrition suggests that the inflammatory nature of a person's diet can drastically influence their risk of suffering a heart attack, stroke, or death. The study, measuring the impact of inflammation to understand how food affects heart health. Researchers tracked 500 adults diagnosed with coronary heart disease over a median period of 38 months. The core of the study relied on the Dietary Inflammatory Index, DII, a scientific tool used to score diets based on their potential to either trigger or suppress inflammation in the body. Pro-inflammatory diets, high in processed foods and refined ingredients. Anti-inflammatory diets, high in plant-based foods and healthy fats. Key findings. The high cost of pro-inflammatory eating, the results revealed a stark correlation between high inflammatory scores and severe cardiovascular complications. For patients already managing CAD, the dietary impact was profound. Increased cardiac risk. Individuals consuming the most pro-inflammatory diets faced an 82% higher risk of major cardiac events, such as heart attacks or strokes, compared to those on the least inflammatory diets. Mortality rates. Those in the highest inflammatory diet group had a 68% higher risk of death from any cause. Event frequency. Nearly 30% of participants on highly inflammatory diets experienced a major cardiac event, compared to just 11.2% of those on anti-inflammatory diets. Incremental risk. For every single unit increase in the Dietary Inflammatory Index score, the risk of a major cardiac event rose by 21%. Why inflammation matters for heart health. It is important to understand why diet affects the heart so directly. In patients with CAD, the arteries are already compromised by plaque buildup. Chronic, low-grade inflammation acts as a catalyst for disaster by destabilizing arterial plaques, making them more likely to rupture. Promoting blood clot formation, which can block blood flow, accelerating the progression of existing cardiovascular disease. Essentially, a highly inflammatory diet can act as a tipping point that turns a manageable condition into a life-threatening emergency. Dietary patterns. What to eat and what to avoid. While the study focused on the index scores rather than a specific meal plan, clinical consensus points to two distinct dietary profiles. High-risk, pro-inflammatory foods. These foods are often low fiber and antioxidants, which are necessary to regulate immune function. Ultra-processed foods and refined carbohydrates, sugary beverages, processed meats and fried foods, excessive saturated and trans fats. Low-risk, anti-inflammatory foods. These foods align with the well-researched Mediterranean-style eating pattern, which is widely considered the gold standard for heart health. Fruits and vegetables, specifically colorful varieties rich in antioxidants. Healthy fats, extra virgin olive oil, nuts and seeds. Omega-3 fatty acids, fatty fish such as salmon, mackerel, and sardines. Whole grains, providing essential fiber. Natural anti-inflammatories, herbs and spices like turmeric, ginger, and garlic. Note, individuals managing heart disease should consult with healthcare professionals or registered dietitians to tailor these dietary principles to their specific medical needs. Conclusion. The evidence suggests that for those living with coronary heart disease, diet is not just about nutrition. It is a critical component of disease management. Shifting toward an anti-inflammatory eating pattern may serve as a vital tool in reducing the risk of major cardiac events and improving long-term survival.